Every Wednesday, our Morning Round series looks at medical issues that could affect you and solutions for a better health. Endometriosis is a reproductive disease that affects women. About half of patients with it have fertility problems, and its cause is still uncertain today. Celebrities including Lena Dunham, Susan Sarandon, Padma, Lakshmi, and Whoopi Goldberg are now helping raise awareness and research money. Our Dr. Narula is here with more on this story. Tara, good morning to you. How many women are affected?
Good morning, Gayle. Well, according to the Endometriosis Foundation of America, the disease impacts an estimated 10% of women in their reproductive years. Because the disease has diverse symptoms and since there's no blood or imaging test, women are often shuttled from doctor to doctor before they get the right diagnosis.
Beautiful.
Georgie Kovacs Barden's path to motherhood spanned 3 years and 12 fertility treatments before she gave birth to her 3-year-old son, Connor.
This is a tray.
At age 40, after seeing 10 doctors, she finally learned why she had difficulty getting pregnant. When you were told you had endometriosis, what was your reaction?
Thank you for giving me a diagnosis. In my gut, I knew. I said, once we figure out the underlying cause, I will get pregnant.
For many women like Georgie, the only sign of endometriosis is infertility, but most patients have severe pain during their menstrual cycle. Endometriosis occurs when tissue similar to the lining of the uterus appears outside the uterine cavity, scattered throughout the pelvis and abdomen. Researchers are still working to understand how this happens.
The lag time between onset of symptoms and diagnosis is usually anywhere from 8 to 10 years.
Dr. Arnold Advincula performs the minimally invasive surgery required to diagnose and remove the telltale lesions that interfere with getting pregnant and disrupt women's lives.
Women are plagued with chronic pain symptoms, which can be quite disruptive to quality of life, and also affects women at a time in their life when they're trying to have a family, trying to have their first baby.
A baby is still a question mark for Stephanie Morris, who was diagnosed 11 years ago.
I can go from feeling perfectly fine in one moment to doubled over in pain, screaming, crying. I remember thinking on my wedding day, like, please, just let me make it through today.
Stephanie now helps educate teenagers who may be unaware that severe pain could be more than just monthly cramps.
We're taught from a very young age to ignore this part of our body.
After struggling with endometriosis for decades, Columbia University researcher Noemi El-Haddad developed a smartphone app to track symptoms and gain a better understanding of the disease.
Was it hard to sleep, to get out of bed?
Data collected from 9,000 women so far shows that women can have pain outside the time of their menstrual period. And symptoms can include things like low back pain, ringing in the ears, bowel and bladder problems, and even chest pain. We talk about technology and apps as ways to give patients control. And this sounds like a very important way to give women a way to have control.
Absolutely, and we can't help them yet with relief, but at least we can give them the validation and the better communication tools.
How do you think your life would have changed if one of those first specialists had said to you, you might have endometriosis?
I would be in a better place financially. I would have more children. I mean, I still am struggling with letting go of not having more children.
Removing lesions with laparoscopic surgery is considered the best treatment option. However, many women may also be treated with hormones, oral contraceptives, painkillers, and even hysterectomy.
Listen, Tara, I know regular cramp pain can just be kind of excruciating. How do you know the difference between regular cramps that can be painful and endometriosis?
And that's a great question. We actually asked Dr. Advincula that. And essentially he said, if the pain and the cramps gets progressively worse over time, and it really can't be relieved with things like NSAIDs, non-steroidal anti-inflammatories. Also, if you have some of those other systemic symptoms like chronic fatigue, bowel or bladder problems, pain with intercourse, all of that should paint a picture that really makes you say, I need to talk to my doctor and ask, do I have endometriosis? And it's important, everybody said, to start this conversation early with teenagers in schools so that they don't go 15 years before they're diagnosed.
Yeah. You can feel the relief of the women saying, I just wanted somebody to tell me what it was.
Right.
I know what it was.
Yeah, what a relief that is. Good to see you. Thanks. This important conversation will continue on our CBS This Morning Facebook page. Tara will be there to answer your questions about endometriosis during the break.